Welcome to the Motivational Midwife. My name's Lynn Jones. I recently received an email from an international midwifery candidate asking if I could do a video, a more detailed video on implementation station for the Osce. So that's what I'm going to cover today. Okay, so we're going to look at the implementation station in a little bit more detail. So some of the things you need to consider is that you're asking your assessor if your drug trolley is clean, stocked and ready for use. You're going to also have to remember that you need to do your hand hygiene and verbalise that in accordance with WHO guidance. And use a PPE appropriate to the trust that you're working in. As a minimum, I would say when you're preparing your medications, then you need to put an apron on, but use whatever is in the trust you are working for. So adhere to whatever their guidelines are. For every drug, you are going to need to check that the container is secure. So, and you have to verbalise this to your assessor. So, assessor, I'm happy that this container is secure. The drug is paracetamol. The dose is 500 milligrams. The expiry date is February 2029. As my client is more than, and as long as she's more than 50 kilos, you can administer a gram. So, verbalise that you recognise that. So as my client is, and when we look at the drug chart, you'll see how much our particular client on the drug chart weighs, which is 75 kilos. So in this instance, I would say as my client is 75 kilos, I'm happy to administer a gram. So I will be dispensing 2 capsules. Then you will undo it, dispense into the cap 2 capsules and put it into a medicine pot, and you need a medicine pot for every separate tablet. You can't put them all into the same one. You want a separate pot for each medication that you're going to be dispensing. You're going to need to verbalise to your assessor that you have a clean tray that is ready with your medicine pots on, okay, so that everything has been cleaned and prepared ready for these medications. You're going to need to ensure that you have checked with your client if she has any swallowing problems and whether she's happy to take her medications with water or whether she'd prefer juice, because not everybody's a big fan of water. Then you take your drug chart. So you've washed your hands, you've got your drug chart. You've read carefully your scenario, because that will tell you what time in the scenario that you are administering medications for. So that could be at 12 o'clock, it could be 2 o'clock, could be later in the afternoon. Okay, so make sure that you have read carefully your instructions so that you know which medications you are actually administering. Then you will take your drug chart to the patient and you will ask her to confirm her name and date of birth. So if we just look front of this drug chart, we're going to ask her to confirm her name and date of birth, and then you're going to ask her if she has any allergies. You're going to check that with her wristband and ensure that she has got the correct colour wristband on. So anyone with allergies will have a red wristband or some way of identifying. In some trusts they have a white wristband but with a red button on it, so that highlights that they have allergies. Other trusts will have an entire red wristband. Okay, so make sure you verbalise to your assessor that she has a red wristband on and she does have allergies. Okay, when you ask her if she's allergic to anything. If she says yes, she is, ask her what the reaction is that she gets when she takes that medication or substance that she's allergic to. And then check that that is what is written on the drug chart. So here you can see she's allergic to latex and she swells up, and that is on the drug chart. Okay, this first box here, and these are the drug charts that are the latest ones that have been put in your supporting documents from the NMC. So these should be the drug charts that you are using, but do always check on the NMC website for their supporting documents and see which ones they are using, because they do change them. This has changed from when the OSCEs first started. So this first box at the top will have the name, her date of birth, her hospital number, your ward and the date of admission, her height, weight, body mass index, consultant if she has one, and her time of admission. Okay, so you're going to verbalize that out loud. You're going to say, right, page 1, Rabia Bibi, 2108-2001, hospital number 123980, height is 160 and weight is 75 kilos, body mass index 29.2, the ward is triage, the consultant is Mr. Taylor, date of admission is today, and admission time is 10:30. The next box is anyone who's prescribed, so I can see that the doctor, C. Smith, has his name and signature and bleep number is in the box, and I'm going to complete this one. So if you're going to be the one that's administering those medications, you need to make sure at some point during this station you have filled in your name, your initials, your signature, and the base that you're working at. So today, for this, it's triage, but it could be antenatal ward, it could be delivery suite. Okay, and you're going to verbalize then, assessor, I can see she has allergies, she's allergic to latex, the effect is she swells up. I can see the doctor's signature and bleep number are there and it is dated. Medication risk factors, I can see pregnancy has been highlighted and nothing else. So there's your front page. Now you're going to check that every page belongs to your client. So you're just checking this bit on every single page and verbalizing that and checking against it. So make sure it's obvious you are checking it against the wristband. Okay, so Rabia Bibi, 2108, hospital number 123980, and look at the wristband at the same time and check that for every single page. And then when you have checked every single page, verbalize to your assessor, assessor, I'm happy all these pages belong to my patient. Rabia, do you have any problems swallowing? Would you like to take your medications with water or juice? And can I ask you, Rabia, have you got any pain at the moment? When did you last have any pain relief? Because you're checking to see when she last had any analgesia, because certainly for paracetamol, if it's within a 4-hour window, you're not going to be able to give her any more. Okay, so give her the call bell and then go to prepare your medications. So explain to her, right, I'm just going to go and prepare my medications. Here's the call bell, I'll be back shortly. Then go to prepare your medications, re-sanitize your hands, put an apron on, and then let's look at the first page that you're actually going to be giving anything on, because you've already checked all the pages belong to your client. You've checked the first page. If you haven't filled that first page in, now's the time to do that. These bits on here are your non-administration codes. So if any of the medications are due in your time frame, so if you're giving the medications for 2 o'clock and one of those that you need to give, you're not going to give because either you can't read the prescription or there's something missing on the prescription or something wrong, then you need to look to see which one of these codes that relates to and complete the back page of the drug chart with the drug, the dose, the date and the code as to why you haven't given it. Okay, so verbalise out loud, once only medications, today, the date is today, the drug is anti-D, the dose is 500 international units, the route is intramuscular, the time is stat, and the doctor's signature and bleep number is there. I'm happy to prepare this medication, and then prepare this. This is an intramuscular medication, therefore prepare it in line with your intramuscular medications marking criteria. And it's possible you may get just that to give an IM medication in your station. So on the second page, even though she's not written up for any of that, you need to verbalise it. So you have to say prescribed oxygen, she's not prescribed any oxygen. Antimicrobials, the drug is cefalexin, the date is today, the dose is 500 milligrams, the frequency is 3 times a day, the route is oral, the duration is 7 days, the times are 8, 2 and 10, the start date is today, the finish date is today plus 7, the prescriber's signature and bleep number is there. This is in my time frame, so I will administer these drugs. Okay, so you are going to then check your drugs, so check the bottle, check the integrity, the expiry date, verbalise all of these. It's not enough to say it's in date, you need to say the actual expiry date, and then dispense the correct dose into a medicine pot, seal the container back up and put it back in the drug trolley. Then move to your next page. Regular medications, levothyroxine, the date is today, 100 micrograms once a day, or the route is oral, the duration is ongoing, the time is 8 o'clock, the start date is today, the finish date is ongoing, the doctor's name, signature and bleep number are there. Assessor, this is not in my time frame, so I will not be dispensing this medication. The next page, there is nothing prescribed on this page. As required medications, the drug is paracetamol, the date is today, the dose is 1 gram, the frequency is 4 to 6 hourly, the route is oral, the duration is ongoing, the start date is today, finish date is ongoing, indications maximum 4 grams in 24 hours, the doctor's signature is there, but I notice his bleep number is missing, but the prescription is signed and it does match with the other signatures, therefore I'm happy to administer this. And again, check your container, the integrity, you verbalise the drug, the dose and the expiry date, and then you dispense the appropriate medications. And in this instance, you can say my patient is over 50 kilos, so I'm happy to prescribe, to dispense 1 gram, and put that in a separate medicine pot. And then on the final page, infusions, there are no infusions prescribed. And then this would be where you would write your omitted doses if there's been any medications that you haven't given. You're then going to go back to your patient with your medications, and you're going to ask her again to confirm her name and date of birth, and you will check that again with the wristband and recheck again if she has any allergies. Then you're going to go through each drug she has got. Okay, so Rabia, this is cefalexin. This is an antibiotic that's been prescribed for your infection. And then you will mention side effects, which for most antibiotics tend to be gastrointestinal, so a bit of nausea, a bit of loose stools. Are you happy to proceed with that? And then you give her the medication and the drink, and then say, have you swallowed that? Okay, then your next medication, this is paracetamol, it's a pain reliever. It can sometimes make you a bit drowsy. So look at the side effects for any drugs that are prescribed. If you're not sure of them, you will have a British National Formulary there that you can look in to see the side effects of drugs. But there is an expectation that you will know at least what the drugs you are giving are being given for, and some of the more common side effects of those drugs. When you have given all the medications, then you can say to her, here is your call bell. I will come back in 30 minutes and just make sure that that pain relief has worked. I'm just going to go and dispose of all my equipment. And then you will verbalise to your assessor, or you will sign your drug chart by the bedside as your patient is taking their medication. Do not sign it before they have taken their medication. So once they've taken it, sign the drug charts in the appropriate places, and then dispose of your empty medicine pots and your PPE and re-sanitize your hands. So there you have a slightly more detailed implementation station. I hope you'll find it helpful. It is important that you touch base with the people that are supporting you to go through your OSCEs, and it's important you look at your own trust's drug administration and medicines management policy. If you haven't got that, then ask your practice development team if they can point you in the direction of where you can find that policy and guideline on the management of medications, because that will give you an awful lot of information as well. The British National Formulary, which you can get online, will also give you a lot of information on various medications. I would suggest that you perhaps look at the more common ones, so pain relievers, antibiotics. Make sure that you know which antibiotics are penicillin based, so that if you have a client with a penicillin allergy and she has been written up for a penicillin-based antibiotic, that you then flag that as an issue to your assessor and say, assessor, my client has actually been prescribed a penicillin-based medication when she is allergic to penicillin, so I will not be giving this medication. I will be getting the prescriber to re-prescribe an appropriate antibiotic. So they're not there to catch you out, they're there to make sure you are safe, and part of being safe is knowing what drugs you can give and what drugs you shouldn't give, and also knowing what drugs are being given for and their side effects, at least the most common side effects. So good luck.